Good morning everyone. Myself Dr. Sejal Gamit, Assistant Professor in Pathology. Today I am going to discuss about necrosis and its type. Today's competencies are describe and discuss cell death and its type, particularly focusing on necrosis, and describe autolysis. Learning objectives of today's competencies are: at the end of the lecture, you are able to define necrosis, able to describe morphology of various types of necrosis, and able to define autolysis. So, before we understand about necrosis, let us first understand about cell death. What is cell death? As we have previously discussed, the cells are normally remain in a steady state, that is called homeostasis. But whenever the cell is exposed to stress or increased demand, the cells try to meet increased demand by undergoing adaptation. But if the limit of adaptive response are exceeded, or if the cells are exposed to injurious agents, a sequence of events follow that is termed as cell injury. If this injurious stimulus is mild, the changes are reversible, so the injury is reversible. But if the stimulus persists for a longer duration, it may cause irreversible cell injury or cell death in the form of necrosis and apoptosis. Today we are going to focus mainly on necrosis, a form of cell death. So what is necrosis? It is a localized area of death of tissue followed by degradation of tissue by hydrolytic enzyme liberated from dead cells. It is defined as denaturation of intracellular protein and enzymatic digestion of lethally injured cells. Necrotic cells are not able to maintain membrane integrity and their content leaked out, a process that may initiate inflammatory reaction. The enzyme that digests the necrotic cells are derived from the lysosomes of dying cells themselves or from the leukocytes. Causes of cell injury which we have already discussed are hypoxia, chemical agents like insecticide, pesticides, physical agents like extremes of temperature trauma, microbial agents like bacteria, viruses and fungi, and immunological injury. There are two characteristic morphological features of necrosis that take place in the cytoplasm and the nucleus. So which are the cytoplasmic changes? In the first figure, you can see normal kidney tubules with viable epithelial cell, while in the second figure, you can see early reversible ischemic changes showing surface bleb, increased eosinophilia of cytoplasm, and swelling of occasional cell. While in the last figure, you can see irreversible cell injury. There is necrosis of the epithelial cell with loss of nuclei, fragmentation of the cell, which lead to leakage of the content. The characteristic nuclear changes are pycnosis, karyorrhexis, and karyolysis. Pycnosis is characterized by nuclear shrinkage and increased basophilia, which is followed by karyorrhexis, which is fragmentation of the nucleus, and karyolysis. The basophilia of the chromatin may fade, a change that is due to loss of DNA because of enzymatic degradation by endonuclease. So there is ultimately disappearance of the nucleus from this cell. Now what is the fate of necrotic cell? First, let us discuss about this figure. Whenever the cell is exposed to mild form of injury, it may lead to reversible cell injury in the form of swelling of mitochondria, endoplasmic reticulum as well as formation of membrane bleb. These changes are reversible if you remove the stimuli. But if the injury persists for a longer duration, it may cause breakage in the plasma membrane which lead to leakage of the content out of the cells. So the cell ultimately undergoing necrosis. These necrotic cells may persist for some time or may be digested by the enzymes and disappear. Dead cell or necrotic cell may be replaced by myelin figure, which are either phagocytosed by the other cell or further degraded into fatty acid. These fatty acid bind with calcium salt, which may result in dead cell ultimately becoming calcified. So there are two fate of necrotic cell. Either they are phagocytosed by the other cell or ultimately became calcified. Types of necrosis. Morphologically, there are 6 types of necrosis: coagulative, liquefactive, gangrenous, caseous, fat, and fibrinoid necrosis. What is coagulative necrosis? It is a form of necrosis in which the underlying tissue architecture is preserved for at least several days. Why the underlying architecture preserved for several days? Because the injury denatures not only the structural protein but also the hydrolytic enzymes, thereby blocking the proteolysis of the dead cell. As a result, eosinophilic enucleated cell may persist until the leukocytes are recruited to the site of necrosis and the dead cells are digested by the action of the lysosomal enzyme of the leukocytes. The cellular debris is then removed by the phagocytosis. How could the coagulative necrosis take place? The reason is ischemia. Ischemia caused by obstruction in a vessel may lead to coagulative necrosis, and an area, localized area, so produced is called infarct. The organ commonly affected by coagulative necrosis are heart, kidney, and spleen. Now, let us discuss about the morphology of coagulative necrosis. The characteristic gross features are: in the early stage, the organ became pale, firm, and slightly swollen. With progression of the injury, they become more yellowish, softer, and shrunken. And microscopically, the hallmark of the coagulative necrosis is the conversion of normal cell into their tombstone cells. Means outline of the cells are retained so that the cell type, but their cytoplasmic and nuclear details are lost. The necrosed cells are swollen and appear more eosinophilic than normal, along with characteristic nuclear changes like pycnosis, karyorrhexis, and karyolysis. Eventually, the necrosed focus is infiltrated by inflammatory cells. Here in the figure, you can see the myocardial infarct, in which you can see there are pale and firm whitish area in the myocardium, which is a characteristic feature seen in myocardial infarction. And on the right side of the figure, you can see normal myocardium. The nuclei of the myocardial fiber are basophilic, open, delicate, and you can easily see the striation. While whenever there is myocardial infarction, it may cause ischemic necrosis. Ischemic area are characterized by loss of nuclei to pycnotic and karyolysis nuclei, increased eosinophilia of the cytoplasm, but retention of the tissue architecture, means you can still identify the organ. This is the figure showing coagulative necrosis of kidney, in which you can see wedge-shaped pale infarct in the kidney. While on the right side, you can see on the microscopic feature of necrosis of the kidney, which shows normal kidney and necrotic cell in the infarct. The necrotic cell in the infarct showing preserved cellular outline with loss of nuclei, and there is inflammatory infiltrate between the interface between the normal and the necrotic area. Now, liquefactive necrosis. In contrast to coagulative necrosis, in which the tissue architecture persists for a several duration, liquefactive necrosis is characterized by digestion of the dead tissue, resulting in transformation of the tissue in a liquid viscous mass. It is commonly seen in focal bacteria and fungal infection because microbes stimulates the accumulation of leukocytes and liberation of enzyme from these cells. If the process was initiated by acute inflammation, as in case of bacterial infection, the material is frequently creamy yellow in color and is called pus. Liquefactive necrosis most commonly occur in the hypoxic death of the CNS. Morphology of the liquefactive necrosis. Grossly, the affected area became soft with liquefied center containing necrotic debris. Later, a cyst wall may be formed. Microscopically, the cystic space contains necrotic cell debris and macrophage filled with phagocytous material. The cyst wall is formed by proliferating capillaries and inflammatory cells, and gliosis, that is proliferating glial cells in case of brain. Proliferating fibroblast you can see in case of abscess cavity. Here the figure showing an impact in the brain, showing dissolution of the brain parenchyma. While on the right side you can see normal brain tissue, and on the right side you can see liquefactive necrosis of the brain, which is characterized by infiltration of the brain parenchyma by mixed inflammatory infiltrate, particularly neutrophils. Gangrenous necrosis. It is usually refers to the condition of a limb, generally the lower leg, that has lost its blood supply and has undergone coagulative necrosis. Remember, coagulative necrosis is caused by blockage of the blood flow. When the bacterial infection is superimposed on coagulative necrosis, it is modified by liquefactive necrosis and attract leukocytes. So ultimately the dry gangrene is replaced by wet gangrene. Here the figure shows gangrenous necrosis of intestine, in which the intestine become blackish in color and have thinned out wall. And on the right side of the figure you can see coagulative necrosis of the affected bowel wall and thrombus vessel, while the junction with normal intestine is indistinct and show inflammatory infiltrate. You can easily see that there are congestion and thrombosis in the necrosed part, while the normal intestine you can easily appreciate. Caseous necrosis. It is encountered most often in the foci of tuberculous infection. Caseous means cheese-like, referring to the friable yellow-white appearance of the area of necrosis. On microscopic examination, the necrotic focus appear as a amorphous granular pink. Unlike the coagulative necrosis, in which the tissue architecture is preserved, in case of caseous necrosis, the tissue architecture is completely obliterated and cellular outline cannot be discernible. Morphology of caseous necrosis. Grossly, you can see foci of caseous necrosis. It looks like dry cheese and are soft, granular and yellowish in color. This appearance is partly attributed to the histotoxic effect of lipopolysaccharide present in the capsule of tuberculous bacilli. Microscopically, the necrous foci are structureless, eosinophilic and contain granular debris. The surrounding tissue shows characteristic granulomatous inflammatory reaction consisting of epithelioid cell with Langerhans type of giant cell and peripheral rim of lymphocytes. So in this figure, you can see multiple cheese-like lesion on the surface of the lung parenchyma. And on the microscopy, you can see the necrotic foci, the foci of caseous necrosis in the center, which is pink and granular, and it is peripherally rimmed by epithelioid cells as well as lymphocytes. So the caseous necrosis along with epithelioid cells and lymphocytes, this all structured together is called as a granuloma, which is a characteristic feature of tuberculous infection. Now fat necrosis refers to the focal areas of fat destruction typically resulting from release of pancreatic lipase in case of acute pancreatitis. What occur in acute pancreatitis? Pancreatic enzyme, that is pancreatic lipase, have leaked out of acinar cells and duct and liquefy the membrane of the fat in the peritoneum, and lipase then split triglyceride ester contained within the fat cell. The released fatty acid from the triglyceride now combine with calcium to produce crossly visible chalky white areas that is called fat saponification. This is the cross figure which show example of fat necrosis, in which you can see the areas of white chalky deposits represent foci of fat necrosis with calcium soft formation, that is fat saponification in the mesentery. And on morphologically, fat necrosis is characterized by necrous fat cells that have cloudy in appearance, that is surrounded by inflammatory reactions. Now fibrinoid necrosis. It is a special form of necrosis visible by only light microscopically, usually in immune reaction in which complex of antigens and antibody are deposited in the wall of arteries. The deposited immune complex together with the fibrin that leaked out of the vessels produces a bright pink and amorphous appearance that is called fibrinoid or fibrin-like appearance. Microscopically, fibrinoid necrosis is identified by brightly eosinophilic hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by nuclear debris or neutrophils, means presence of neutrophil in the vessel's wall. Sometimes local hemorrhage may be seen due to the rupture of blood vessels. This is all about necrosis. Now let us see about autolysis. What is autolysis? It is a postmortem cell death, while the necrosis is antemortem pathological cell death. So what occurs in the autolysis? When the organism dies, the cells begin the process of self-digestion. Enzymes within each cells are released and work to destroy the cells. This process is termed as autolysis. So what is the difference between autolysis and necrosis? In case of autolysis, no sharp line of demarcation seen between the affected and healthy tissue, while a line of demarcation is present in necrosis. In case of autolysis, circulatory changes like congestion and hemorrhage are absent, while congestion and hemorrhage are usually present in case of necrosis. Inflammatory changes are absent in autolysis, why it is a characteristic finding in case of necrosis. Growth of saprophytic bacteria are often present in autolysis, while in case of necrosis, saprophytic growth not seen, but pathogenic bacteria may be present. So, this figure demonstrates the autolysis of liver. On the left side, you can see normal lung parenchyma, while on the right side, you can see there are homogeneous eosinophilic tissue with loss of nucleus. So, on the basis of this, you cannot identify which is the organ. On the basis of this, you cannot able to determine the type of tissue. So, this is called as autolysis. These are my references. Thank you.